in communities of color and communities where infection rates for COVID have been the highest, so those that are hardest hit. If we could go to the next slide. In terms of the ensuring basic and essential needs focus area, our thoughts are that the lead agency or lead organizations could be the core service agencies, our Department of Housing, our Department of Human Services, and of the Second Harvest Food Bank. And then support organizations would be community-based nonprofits, faith-based organizations, foundations, other organizations that are essentially working to support our most vulnerable populations. Some of the main objectives within this focus area would be to provide targeted financial and other assistance to ensure that vulnerable residents remain housed, increasing the number of affordable housing units throughout San Mateo County, providing support to renters and to small property owners, making sure that we address both sides of that equation. And then finally, ensuring sufficient food and essential supplies are provided to those in the highest need. Okay, if we could go to the next slide. In terms of bridging the digital divide, this is an issue that actually came up across, I think, almost every committee. You know, obviously with the shelter orders and health directives, people are increasingly reliant on the internet to get many of the services, to engage with their work, to get school, for learning. So the reliance on the internet is has increased tremendously. It's also, the pandemic has also really exacerbated the digital divide. So we have a recommendation to help bridge that digital divide, and the lead organizations that we've identified would be the Office of Education and our County Information Services Department. They've already partnered to work on pilot projects in this space, and through the Recovery Initiative, we hope that work could be expanded. Some of the support organizations include SAMCETA, community-based nonprofits, the school districts, the library systems, internet providers, tech firms, and as I said, the objectives would be to provide Wi-Fi access countywide. Now, not just Wi-Fi access, because we know that communities, individuals, even small businesses need support to be able to access that Wi-Fi. So alongside that connectivity, we would envision providing technical training and support options, and then support to parents and children who are grappling with a new virtual learning environment. Okay, our next focus area is in quality care for children, and this is really both childcare for children up to age 5, as well as care for students who normally would be in school, but are now perhaps in a virtual learning environment and might need childcare or other supports for that, as well as kind of childcare for the after-school hours, if you will. So even when children are not in virtual learning time, they may still need some childcare to bridge to when their parents are done working. The lead organizations in this effort would be 4Cs, First Five, Big Lift, and some of the support organizations would be community-based nonprofits, the faith-based community, cities, school districts, and the Office of Education. And the way that we laid out the objectives for this area were to really focus on the providers as well as the families. So how do we support childcare providers and out-of-school care providers to remain solvent so that they can continue to help meet the needs of the community? And then how do we support the families in identifying what care options are available and getting them actually connected to those care options so that they can get quality, safe, and affordable care for their children? And then finally, in this area, we wanted to think about supporting parents and children through the virtual learning process, which is new for pretty much all of us. If we can go to the next slide. The second focus area within our Vulnerable Populations Committee work was ensuring access to mental health resources. And much like the digital divide, this came up across many of the committees. We ended up housing it within our Vulnerable Populations Committee, but it certainly crosses many of the committee's work areas. we would see the lead organization in this effort as San Mateo County's Behavioral Health and Recovery Services, with support from the community-based nonprofits, the schools, the faith-based community foundations, and private insurers, all who are providing mental health services and resources to the community already. And the objectives would be to, communicate to the public. There are many resources that are out there already that could be of support to people with regards to their mental health. And so making sure that we use a variety of communication channels so that they know about that support, and doing that in a linguistically and culturally appropriate manner. In particular, we would want to be reaching those whose conditions may have been exacerbated by the pandemic, or individuals who are, cut off from their support systems because of the pandemic. So making sure, the first objective, making sure people are aware of what resources are out there. And then secondly, how do we expand the capacity of the community-based organizations that are currently providing mental health needs resources? How do we fund them so that they can increase those services offered? And then finally, support programs that are providing a lifeline for isolated individuals. For example, the Institute on Aging has a line that older adults can call to get support, even just in addressing loneliness and isolation. And then, of course, more serious mental health conditions as well. Okay, if we can go to the next slide. Within our economic recovery work, we're not only looking at supporting small businesses, but we're also thinking about how do we support the workforce. The jobs that were once there are no longer, and people need to get back to work now. They can't wait till the end of the pandemic. So we're trying to think about how do we get people back to work now, into new jobs, and what is the future of the economy? Where are the jobs going to be? We see the lead organization here being NOVA, which is basically the Workforce Investment Board for San Mateo County and Santa Clara County, alongside Job Train and the Human Services Agency. And then some of the support organizations that we've identified include the community colleges, the colleges and universities, labor, SAMCETA, and Thrive. And the objectives would be to really gather job market intelligence to understand where we see the economy going, and then to provide relevant training programs and to get people back to work. We can go to the next slide. So I know that was a lot of information. Here is a summary of some of the main leads that we see for implementation. I guess what I would like to point out with this is that you'll see that the county is listed in many of these bubbles, but you'll also note that there are many partners in addition to the county. And I think what we're trying to emphasize is that recovery from the pandemic is not a one organization job. What we need to do is to all work together. And so that's the reason that we're reaching out to your organizations today, and that we've been trying to reach out to many stakeholders, because we need your help. We need to all do this together to be able to support the community through recovery. If we could go to the next slide. Okay, I know that was a lot of
about this issue.
Information. Are there any? We have actually Q&A scheduled for the whole second half of the session. So if we could go back to menti.com, great, thank you. I see people are starting to fill this out. Your browser should have refreshed itself. We're just asking which objectives and recommendations resonate with you. And I thank you for also placing comments into the chat. We're capturing that as well. We'll just give it a moment for people to it seems like there's fairly even distribution across these focus areas. which to me would indicate that we're heading in the right direction, that all of these are important. Christine, I see your comment about community-based organizations. I think that we see CBOs as being within each of the focus areas, but the focus areas are more oriented to a topic. And yes, we tried to select the focus areas that we thought would be most resonant with Thrive and your membership. So we didn't walk through every focus area. We left out a few, mostly considering time. So transportation is within the overall recovery initiative, but it wasn't highlighted during today's presentation. Okay. Thank you all for the feedback, and I will hand it back over to Jessica.
Thank you, Danielle. So for our implementation plan, we wanted to kind of walk through next steps with all of you. So the County Recovery Initiative staff, myself, Peggy, Danielle, and Megan, we are convening with the leads and the support organizations, and we'll sort of talk with them about the next steps in the implementation plan, and then continue to sort of look at opportunities for how we can maybe expand organizations that are involved in implementing the plan, identify some resources, and see how we can continue to support implementation of the recommendations and strategies that have been identified through the work plan. Additionally, we want to have the equity recovery group members join any of the working groups that have been sort of identified for each of the focus areas, or specifically on any of the recommendations, to make sure that the programs and policies and strategies are resonating with our community members, if anything needs to be tweaked, or thinking through how we go about structuring implementation for those strategies. We will also share and affirm on the recovery initiative recommendations and implementation plan with our lead organizations. We're beginning to meet with some of the lead organizations to sort of make sure this sort of fits within their capacity, sort of identify any resources that maybe need to be identified or developed to be able to implement that, sort of working with them and partnering with them on how to move forward. And then we'll develop focus area work plans, looking at staffing, and then identify what the near and long-term funding needs and opportunities are with everyone going forward. Go to our next slide. And then for tracking progress, we will report the progress out regularly to the Recovery Coordinating Council and committees. We're also developing a public-facing website which can track the progress and indicators. I think there was a question in the chat around will this presentation be available to the public? The idea with a public-facing website is also to sort of have this online where people can provide a general overview of what the Recovery Initiative work plan is, as well as the implementation plan. And then for folks who want to take a deeper dive, we'll have all the information there as well, so that folks can kind of look at some of the particular recommendations and then identify resources and programs associated with those. As well as we will do a constant review and update of the work plan in the implementation plan to remain flexible to the changing circumstances. We know that this pandemic is, we still have phases to go through with this. So if anything emerges during this pandemic before a vaccine is developed and implemented throughout the community, we want to make sure that the plan has some flexibility in there to be able to respond to the public health situations that may emerge, as well as any community needs, resources, or fundings that come forward in terms of.
Sorry,
This is a
pause
separate
one
issue
second.
altogether.
I want to
We are
mention that
so
Cindy isn't on mute, so please mute yourself, whoever is having a phone conversation in the background. Thank you. Okay.
I have to apologize, Georgia, that may be my husband. But those are sort of next steps as well.
In fact, the governor.
Sorry.
No, it's okay. It's a small office. And then we have wanted to open this up.
I actually
for
believe
any
that he was
questions
going
that
to
may
take
emerge.
this on as an issue.
All right. Apologies for that, Jessica. I did not realize
Nope.
we were getting some comments
economic
in the chat about that, and we couldn't figure out how to mute. But anyway, thank you to the county for this report and for all the thought and for tailoring it to our group. We have several speakers lined up. I wanted to mention that the draft plan, the detailed draft plan, was sent to everybody in advance. It includes areas that were not highlighted today, like transportation. I also want to mention that the arts is an area of concern for Thrive as well. I've noted in the chat that a lot of people are asking about arts and other areas that are not addressed. And I think for the purposes of today, we're focusing on a couple of the areas that are in the plan. But the arts is an area that we care about, and we hope, and I guess this is a bit of a question for the county. I'm thinking in the workforce development piece, in the small businesses piece, in the part where of the plan where we're talking about sustainability of businesses, including nonprofits. The arts is something that will be able to be addressed in that within that area. Is that something that is a fair, I don't know, assumption?
Definitely.
Okay.
Thanks
great.
for summing it up so well, Georgia.
Okay. Great. So we have a series of speakers today, and I wanted to first kick it off with workforce development. Ruben Avalar, Director of Career Services at JobTrain. They're one of the lead agencies on, I think, potentially one of the lead agencies in the workforce development piece. Ruben, I know you were having video trouble before. Are you able to join us either by chat or anything? Yes. Oh.
I'm here. We were able to take care of that. Can you hear me?
Ruben, can everybody hear Ruben? It's a bit muffled, Ruben.
Okay, well, first I want to thank you for inviting me to this event, and also I want to recognize all the individuals who contributed to the County Recovery Initiative.
Hey, Ruben, sorry to interrupt you. I think it's, I think the sound quality is not coming through. I think what we'll do, just for the purposes of time, is move to the next area and then revisit workforce development after. And maybe you can troubleshoot that. Does that work for you, Ruben? Okay, thanks. Sorry about that, Ruben. So let's go to Digital Divide and Educational Access for Families. Linda Prieto, Executive Director of Upward Scholars.
Thank you, Georgia. Good morning, everyone. Again, I'm the Executive Director of Upward Scholars, and we're a local nonprofit dedicated to serving immigrants and first-generation Americans from low-income households across San Mateo County, who, with our support, attend community, acquire the skills necessary to read and write English, and secure jobs that pay a sustainable living wage. Our work has also taken new meaning and urgency in the wake of COVID. Many of our adult immigrant students have since mid-March lost their jobs in the highest impacted industries for residents from low-income households, the service and hospitality sectors. With a move to distance learning at the community colleges as well, technology and connectivity for all remains the #1 priority in the area of the digital divide as we work to bridge educational welfare families and individuals from a low-income bracket. When we discuss the challenges, needs, and programs associated with technology and connectivity of students, I urge us to continue to include our local community colleges and nonprofit organizations serving this particular demographic in set discussions and collaborations as well. 2/3 of the adult immigrants we serve are parents of school-aged children, so their educational goals and digital needs are far and wide. They indeed need access to high-quality broadband internet that can serve multiple devices at once, streaming virtual conferencing like this throughout the day, and support for how to maintain everyone digitally connected in pursuit of their education and career goals. However, reduced internet programs alone are not the solution, as this places heads of household in the difficult situation of deciding between meeting their basic needs and paying for low-cost internet. Establishing hotspot initiatives that serve families from low-income backgrounds with children in K-12 schools results in most children getting access, as our community has already done. However, the need remains for their parents to have simultaneous access to contact schools and other community service providers, such as those on this call today. And in the case of our adult immigrant students, for them to also continue successfully enrolled in their community college courses. So if only one hotspot device is issued per household, it must have sufficient high-speed data to serve everyone's need, or an unlimited plan altogether. For our adult students, the average family size runs between 4 to 5 people, with the average household size upwards of 10 to 13 people. Then there's also the other third of our students who do not have children and find it even more difficult to qualify for low-cost internet or a free hotspot. So my suggestion for how to best implement the plan's recommendations for our organization and the wider community center around starting by first providing access and support to the neighborhoods across San Mateo County where our most vulnerable reside. So they don't need to rely on transportation to get to a place with free outdoor Wi-Fi access, especially in extreme weather conditions or with poor air quality index, or during limited times of day for safety reasons as well. As these developments are underway, I also urge us to support an expanded hotspot borrowing program at every San Mateo County Public Library that can allow patrons to borrow hotspots for longer periods of time and with an ongoing option to renew. I also want to specify that we serve all immigrants from low-income backgrounds regardless of their citizenship status, because we know they are vital to the economy and social fabric of our community. Thus, having Wi-Fi technology and digital literacy programs available to our entire community must truly be an inclusive agenda. In closing, I appreciate and commend everyone's work to date on this informative recovery plan, and I do look forward to our ongoing discussions and collaborations to take us through plan and implementation. Thank you very much, and I'll add my contact info to that.
Thank you so much, Linda, for speaking to the digital divide and educational access. Really appreciate it. We are going to move on to mental health now. Again, everyone reviewed the plan ahead of time, and we have CEOs of 2 large organizations addressing mental health needs in San Mateo County that have reviewed the plan and are providing their input on strengths, gaps, and also implementation recommendations. First, would love to hear from Sarah Larios Mitchell, who's CEO of Star Vista.
All right, thank you, Georgia. Thank you, everyone. Great to be here with all of you. My name's Sarah Larios Mitchell. I'm the Star Vista CEO, and my pronouns are she, her, and hers. And overall, I just want to share, I think it's a great plan. The identified challenges, identified needs, and indicators are all very good. And I think the objectives and recommendations are also overall good. I want to focus first on the strengths of this mental health and wellness component of the plan. I think the challenges that are identified are overall good. And just to piggyback on what the first speaker was sharing, I think a lack of internet access is a major issue, a lack of cell phones, tablets, laptops for clients and staff, so that they're able to conduct remote sessions, since most of our work is being conducted in that way. Access to technology for clients who are struggling with severe mental health and are struggling with recovery, as well as our transition age youth. So we need to provide tech and training. I think that's really important. I think a lot of our clients also are experiencing a tremendous amount of social isolation. We need support for these isolated communities, including the severely mentally ill, those in recovery, the LGBTQ community, families with young children and youth, the Latinx community, Black community, people of color, those that are monolingual in other languages. Something that's missing, I think, from the challenges that are identified is that there's an increase in parental stress and the supports that they need in order to get through this crisis. Parents are juggling remote work, distance learning, balancing their own stress and anxiety while supporting their children and families, and living through once-in-a-lifetime things like what's happening today. It looks like we're at Mars right now. It's just a very unsettling time, and we need to make sure that parents have the support that they need. The plan's indicators, I think, for the needs are good. So as an example, the calls to our suicide prevention hotline, we've seen since April a 25% increase in calls, and a lot of these are first-time callers. They're calling about depression, anxiety, job loss, gender identity issues, parental stress, and COVID are the top issues. We also think that using the data on calls to CPS is also a good indicator. And I think something that's missing that could be added would be calls to law enforcement during COVID for mental health issues. So we partner very closely with them, and I'm sure that there's a lot of data there that can be used. Also tracking parental stress. They do so much to support their families. I think that's also very important. Another indicator that you might consider would be the calls from the LGBTQ community or their allies, family members to the Pride Center, which is right here in San Mateo County. We operate that in partnership with other organizations. We track a lot of data there in terms of demographics and the reasons that folks are calling. In terms of general gaps, I think there are still transportation issues for clients who need things like Uber or Lyft, folks who are trying to make it to a DUI group who don't have their own transportation. Language barriers, so not having enough staff who are able to speak threshold languages, including Chinese. So I think there are a lot more that could be done there. And I think one other point we wanted to really focus on is COVID testing. We really appreciate all the work that's being done, but we have a lot of staff who are still working in shelters. They're still seeing clients face to face, and we need to be sure that they get the testing that they need. I think last 2 points I want to focus on here is the importance of the social justice movement that's happening now. I think there's more need for training for agencies when it comes to DEI, so diversity, equity, and inclusion. And I think it's important to support our organizations with this work. There are a lot of marginalized communities, and we need to find ways of finding them. There are immigrant communities, LGBTQ communities, non-English speaking communities. So I think any support that we can get from the county will be really helpful. And then lastly, we need to continue discussing the need to work closely with law enforcement, as they may oftentimes be the first there to meet with folks who have a mental illness or some kind of issue. And I think, to highlight some of the work that San Mateo PD is doing is good. So our agency partners quite a bit with law enforcement. So I think including some of that here in the plan would be really helpful. In terms of implementation ideas, funds for a lending library for IT equipment, just to highlight again what's already been called out, improved internet access, funds for language translation services, improved outreach, ongoing support for CBOs and how to best meet client needs who are not able to come in during the pandemic, and to continue to support the great work that CBOs are doing. So that's it for me. Thank you.
Sarah, thank you so much. See in the chat, a lot of people are really grateful that you've elevated the issue of COVID testing, among other things, so thank you. We're gonna move to Mark Cloutier, who is the CEO of Caminar, another wonderful provider of mental health services. And you are on mute, Mark.
Thank you. Thanks for catching that I was on mute. Thanks to everyone who's on the call and to Georgia for organizing this. I would just want to start out with some general observations that I think the plan seems very comprehensive and has great stakeholder outreach and base. It shows great possibilities for collaboration. Some areas, there's one area that I think is missing a little bit, and we know from the behavioral and medical health literature that when people face quarantine, it's often a year delay in the most serious symptoms showing up. So what happens is that people are in quarantine, it eases, they return back to normal life, and then they have symptoms that they experience during the quarantine that will not go away, and that takes about a year to show up. So I think we need to be thinking about the demand for mental health services in particular is going to continue to go up, and there may be a very steep increase in March of 2021. I would add there's one piece that may be missing too, which is a population-based mental health promotion strategy. I think a lot of the services in a good way are focused on providing care services to individuals and perhaps institutions. But I think we need to think at a population level, what do we need to do to be promoting the overall mental health of the community that we could do through institutions or social marketing or other ways of getting at total population impact. Then I just want to say, I mean, I know this is written in the plan. I appreciate the focus on equity, but I really want to sharpen that. And I wish I had a time to throw up the graphic, but for many of you, I assume, who've done equity work, there's the comparison of equity and equality, and it's people trying to look over a fence. And equality has that there are people of different heights, and they all get the same size ladder to stand on, but only the tallest people can see over. Equity, of course, is giving people different ladders based on their height so that everyone can see over. So using that as a metaphor, I want to ask that we think about directing all priorities of resources and attention first to communities of color and to low-income communities. And I say that because we went through a recovery in the last economic downturn, and the effect of that recovery was to make, of course, wealthier people wealthier and low-income people poorer. And I think this moment of social justice and understanding structural racism reminds us that we need to put moving assets, moving decision-making, moving power, moving capital and social capital and infrastructure first to communities of color. So let's not think of equity as a collateral value, but as a principle we want to prioritize. Let's put it first, and let's put it up front. So an example of that would be when we're allocating resources for, let's start first by allocating required resources to communities of color or communities that are experiencing poverty. So for instance, around COVID-19 prevention resources, to prevent new infections and then to get better focus on earlier intervention. We know that in communities of color that there's higher infection rates. We also know that people have a more severe and earlier progression to disease. So we want the resources to go first to those communities. And this by prioritizing the resources first, the image that I have, kind of like the standing on the ladders, is that each community has a bucket that it's able to receive resources in, and there's a sequence to those buckets. Let's fill the buckets to the top in communities of color and low-income communities. So with that, I want to thank you all again for the ambitiousness of this plan. And as a county mental health provider that also provides housing support, education support, and job training, we look forward to collaborating with everyone on the success of this plan. Thank you.
Thank you so much. Thank you, Mark. Now we're going to move to the area of housing, homelessness, food security, and seniors, kind of all in one. I want to invite first Stuart Highland, who is Organizing Director of Housing Leadership Council of San Mateo County, to speak from the housing perspective.
Well, thank you, Georgia and Petra, for hosting today. Housing Leadership Council of San Mateo County is a membership organization that works with our partners to preserve and expand the range and supply of adequate, accessible, and affordable housing for residents and workers of San Mateo County. We organize to ensure that everyone who works here, lives here, or grows up here can obtain a suitable home. I want to say that the Vulnerable Population Subcommittee, where I participated, was really well represented in the report. I want to commend staff on pulling together a lot of different points of view and in a coherent way where we can see what's happening. Before I go much further, I just want to say what I heard from Sarah and Mark, I think are critical around equitable change that's going to last. One thing that we're concerned about is a long-term vision to come out of this recovery. And our work in Housing Leadership Council has taught us that what's existed before, not having healthy, stable housing that you can afford without 2 or 3 jobs or 3 to 5 jobs is really even more critical now. However we come out of this recovery, the new normal cannot be a repeat of what's happening. There should be real change, and we should use this time to really. So in thinking about long-term, we're very much concerned with renters' debt. So the rental assistance that's considered in the plan has to be distributed equitably. And so our concern about that is how does it get to small landlords in places that are predominantly people of color, where they may just have like one extra unit or something like that, where they're trying to build wealth as people of color. How are they going to be reached? So we're really concerned about making those connections in a way that's culturally appropriate, language appropriate, and in many cases utilizes the faith community. So in implementation of that, developing that really robust information sharing is essential. So making sure that folks will be able to access rental assistance, or in some cases mortgage assistance. And we've had some success with that, with our mayor participating in East Palo Alto and directly with Samaritan House. So there's some really good examples of success where it's happened, but we need to continue that. And so one of the things that we would like to see from HLC is a map of service providers that sort of matches geographically with the with the allies in those particular geographic areas. And if it's not complete, how to expand that deeper, so that again we have that robust information delivery that's culturally appropriate and also trusted in those communities. We also encourage really strongly partnering with affordable housing developers who have tenants who are in a position where they're in a healthy home, they're able to shelter in place safely, but they don't have income coming in. And so how can we partner with them to make sure that they remain safely housed? We're thinking of all the usual lobbying points, like at state and federal level for Section 8 HUD or emergency service grants. But as I was just reminded in the chat by one of my policy committee members, partnering with the private and corporate community to help do this as well. And all of this really does come back to the whole idea of the COVID in a very real sense, in that sheltering in place makes it clear that housing is healthcare. It's essential to not only a good quality of life in supposedly normal times when we just had to deal with poverty, to the point where we're dealing with poverty and a pandemic. So again, I want to reiterate, I actually want to echo what Mark was saying earlier about change the way that we do things so that when we come out of this recovery, it's a recovery for everyone. And starting first with those to us. Thank you.
Thank you so much, Stuart. Really appreciate your comments. We're going to move to Sandy Winter, Executive Director of Senior Co-Siders now.
Hi, thank you so much for giving me an opportunity to talk about the perspectives of older adults. I first want to give my recommendations about what a great initiative this is. I think it's clearly well thought out and has engaged many of the important stakeholders. I think the guiding principles of public health, equity, fiscal responsibility, and community collaboration are spot on. I would, as an advocate for older adults, I want to make sure that even though the plan says that the voices of older adults will be heard, I want to make sure that that actually does happen. And so, for example, including people like the Commission on Aging, I think would be important. I did notice when I reviewed the plan that under the metrics section, there was no metrics around transportation. So I think that might be something that could be looked at. Regarding the reducing the spread of COVID, one of the gaps that I see in the plan is, my understanding is that the physical recovery from COVID-19 takes a long time. And so once people are released from hospital, there could be months where they have fatigue and have extended symptoms. We don't know what the long-term effects of this are going to be. So I would say that not only focusing on reducing the spread, but on making sure that the people who need support while they recover is something that is addressed. In terms of reducing the spread, I think that community-based organizations and nonprofits can assist with promoting community compliance with the health directives, because we are engaged and connected with our community, and we can do this in a culturally and linguistically appropriate way. So I think that we can support with the implementation suggestions. I want to echo what so many people have said about the importance of technology connectivity, and the recognition that high quality broadband internet is needed for everybody in San Mateo County. And this is particularly true for adults who are facing lots of social isolation. And again, I think that community-based organizations can help with training. They can provide a resource hub where they can provide loaner computers or hotspots. We have a computer lab here, so we can, you know, once we open up again, community-based organizations, I think, can be a resource for training and providing resources. In terms of the safe transportation options, many older adults lose their ability to drive, and so making sure that public transport is accessible and safe to older adults is something that's really important. Some suggestions for that regarding implementation would be to do some peer-to-peer ride-sharing organizations, so something like Uber and Lyft, but maybe older adults are less comfortable about driving with younger people, and so finding a platform where younger older adults who have maybe just recently retired and who like to drive and are sociable could maybe provide ride-sharing services for older adults. So that would be one possibility. And then also to expand the infrastructure for things like tricycles and electric bikes, which are perhaps a more accessible way of active transportation for older adults. One other thing that is particularly worrisome to us here on the coast, I'm in Half Moon Bay, is we felt this recently with the fires, is that there are very limited transportation options for people in terms of evacuation. So many older adults are on wheelchairs, they have walkers, they are carrying oxygen canisters, and if they don't drive and they're reliant on public transportation, it can't just be any old bus. It has to be a bus that is suitable for people with disabilities, so for disabilities and for people who are older adults. On the section on local businesses and nonprofits, I felt that seemed to be crafted more from the perspective of businesses. There was actually not much in there in terms of nonprofits, so none of the indicators were indicators of nonprofit status. It was all about businesses. And I think that there needs to be specific recognition that when other safety nets fail, nonprofits are the safety net that is left available. And so often we are asked to do more with less. And so I think that that needs to be more explicitly recognized so that it can be addressed in future activities. One of the other things that I feel is so important, and it sort of resonates across the different themes, is to work more closely with the existing agencies. And at the risk of being a little controversial, I'm going to give as an example the Great Plates Initiative. So this was a wonderful initiative that Gavin and Newsom had to help support restaurants and to provide seniors with meals. However, it completely overlooked the existing infrastructure of the Meals on Wheels and the home delivery programs that have been up and running for decades and supply so many meals. And instead of reinventing the wheel with this great new initiative of the Great Plates, I think that there was a lost opportunity to partner with the organizations that were already doing this work and support and sustain them in a better way. And so I think that for looking at vulnerable populations, for all of these issues, transportation, homelessness, work more closely with the people who are already doing the job. Don't reinvent the wheel. Then in terms of mental health and wellness, I think that it's been said, and I echo it, that there are and will be substantial negative effects on mental health, of social isolation and all of the stress and anxiety that we're experiencing. So I think that's a strength that it's in the program. There was no specific reference to elder abuse, and there is a lot of elder abuse that happens, and so I think that that's a gap that needs to be addressed.
Sandra, We're just gonna have to, for time, do a time check now.
Okay.
But go ahead and wrap up. And then,
Okay.
yeah.
So one of the other things is that there are lots of scams, COVID-related scams going on that I think it would be important to address. So the last couple of things I'm going to say is that in terms of long-term care, there are tremendous possibilities for helping people to stay in their homes longer, which is a cheaper and more effective option than have them go into assisted living. And so that whole piece, I think, could be built out. And then, yep, I think I'll just call it a day there then. One other thing is, while we're doing this, let's be green, let's be sustainable in all of the plans that we have as we move forward. A bigger emphasis on that. Thank you.
Thank you, Sandy. Thanks for lifting up the piece around nonprofits and looking at how we can partner more effectively with existing programs. I think that was a really, really powerful point. So thank you for making that. We're going to move to childcare. Shaquille Kareem, I wanted to just mention that we are running short on time. We are, please put your questions in the chat, things that don't get addressed today. I know the county will work hard on addressing in writing if they can. And so Shaquille, are you with us?
I'm with you. Thank you.
All right.
Hi, everyone. Good morning. I will be quick to my points. My name is Shaquille. I'm with the YMCA of San Francisco. I'm specifically working in San Mateo County now with the Peninsula Program branch. We're working closely with San Bruno Parkside and Jefferson Elementary on their distance learning out of school time programs. In addition, our facility is also an open learning center for students ranging ages from kindergarten to 5th grade. So the YMCA has always been serving youth and families at the beginning of this pandemic, and we continue to do so through currently pressing and changing times. I want to just take a minute to say I appreciate the composition of this plan and the detail that lists all the recommendations to the comparative objective. I think there are a lot of good points that have been made out here in the challenge bucket, and we're going to continue to have those same challenges throughout the course of this entire year. Childcare and out-of-school time learning is a compounding bucket of all the problems that we have mentioned earlier today, from mental health issues to technology gap to transportation. We're seeing a lot of challenges through our wealth disparity as we speak. So we're seeing that currently a lot of the families that can access our learning camps are families that are well-resourced and connected and have the agency and linguistic skill to navigate and find these camps or learning centers. So one challenge that I want to name out front is that there is a huge portion of our community that we're not seeing and not necessarily always serving unless we have direct relationships with those individuals or people who know those individuals. Some things that we have done already are closer review every state and county ordinance that has come out and implemented a safety training plan for all of our employees. And then we share that training plan with all the parents for their children that enroll in our centers. We find that this type of transparency helps ease and creates a sense of culture on hygiene, on expectations, and policies and protocols. That way, if anything were to happen inside our centers, there's a clear understanding of what comes next. One of the other things that we have done with distance learning is making accommodations with IEPs and 504 plans. That has been a big challenge, but the Learning Center offers a special window and method of time that distance learning can't provide, being in physical space. So we're trying to maximize the opportunity and leverage that a child being in a center can have versus a child just being at home and distance learning. The contrast is distance learning is designed for one-on-one approaches at home with minimal or one-on-one adult support. And when you're inside a center, you have less adults and more children, so the schedules don't always match up and sync up accurately. One of the biggest things that we do need is funding. Money is going to come down to the point of how much we can serve. Right now, everything seems to be working, and we're able to still give out financial aid and maintain a good balance to sustain our payroll and our supply purchases. But the more we expand, and depending on who our clientele is, if we're really trying to be equitable and reach the other side of the divide, we're going to need more funding to subsidize that. we do have that, we do have forced fees and the county reimbursement plan going, but right now we're having kind of a hold up with the effectiveness of getting that paperwork in and out, and getting the reimbursements effectively done on time or done to the right people. So there's also now, we're trying to figure out what's the tier approach of who gets the subsidy first. So those are just a few of the things to name. I don't want to take any more time because I know we've got 5 minutes left here. Yeah, there's a lot going on.
Thank you, Shaquille. Thank you so much. And now we're going to go back to workforce development in the few minutes that we have left. This is our last area. And Ruben Avalar, I'm hoping that you are able to.
Can you hear me? No?
Yes, yes.
Okay, good. Thank you. Good morning, everyone. I'll be relatively brief. First, I want to thank everybody who put this initiative together. It was very thorough and comprehensive. Secondly, I think it's a good start. As you know, it will require a tremendous amount of effort and commitment to be effective and successful. The way I look at this recovery is that you're building a plane and flying it at the same time. That's kind of where we're going to have to be with this thing, constantly adapting, evolving, and evaluating, how the merits of the initiatives, and are we being effective in helping those most in need. For those of you who don't know, Job Train's been around for 56 years. It's a nonprofit career training center located at Menlo Park. We offer career training, job readiness services, supportive services, and we have career centers located in Menlo Park, East Palo Alto, and San Jose. With initiatives, we're looking at big pictures, and as we all know, the devil's in the details, right? And so for me, what I see as being really, really important, we have to develop is a comprehensive, warm handoff as it pertains to the referral process, build it around coordinating more effectively on how people are being served and what other services they're getting, so they don't get, there's not a redundancy of services or duplication or a drop off or people are referred that we don't know what's going on with them. So it's very important that's solid in this thing, because we're all going to be counting on each other to help the community at large, and we want to be able to follow up on the services that they're getting and whether or not the services are being effective. The other thing that I see that we need to develop strongly is this employer relationships. Will be working with the workforce, working with employers with looking at employment opportunities, but also how to prepare the new workforce. What can we do in collaboration with them to assure that the community at large is able to qualify for those jobs? And if it means also retraining, that we work very closely with the community colleges and the adult ed programs as well, because they're there to educate the community. And I think they're going to have to retool themselves too to be able to turn on a dime and give comprehensive training for people to be able to re-enter the workforce sooner than a one-year certificate program or an AA degree. And the big thing that I see is building stronger partnerships with all sectors, employment, nonprofits, and so forth is going to be really important. But for me, the big thing is building this deeper employer commitment. I worked in a workforce now for over 20 years, and it's always been the weak link in everything that the county did under the Workforce Investment Opportunity Act, is employers just are not willing to step up and be thoroughly engaged in providing comprehensive support in hiring people who come through the one-stop centers. So I think that we need to just kind of strengthen that, build it up, so that we can, count on employers to do their part to help our communities recover from COVID-19. And that's it.
Thank you so much, Ruben, and thanks to Job Train for leading those efforts. We are going to move now to workforce development, but from a green perspective with Doug Silverstein, who is Thrive Alliance's environmental lead. And we've heard in the chat and from Sandy that this is an area that I think people want more emphasis on. So Doug.
Yeah, thank you, Georgia. Can you hear me now?
Mm-hmm.
Yeah, thank you, Georgia, and thanks to the county manager's office. In reviewing the recovery initiative document, we noticed there's a missed opportunity to incorporate environment and sustainability goals in the county's long-term strategic recovery. So in the area of environment and sustainability, our San Mateo County community has 4 major concerns, but we also have dozens of solutions to address these challenges. Our concerns are: 1, environmental justice, where some communities are more polluted than others. 2 is our warming climate caused by overuse of fossil fuels and other natural resources. 3 is climate change resiliency. It's the challenges we currently face with increases in fire and heat and drought, which are only going to grow. And poor visibility of green jobs projects. So projects that create meaningful work that address those other issues of injustice, climate change, and resiliency. The good news is that our cross-sector and collaborative community has dozens of shovel-ready green jobs projects that create meaningful work and drive new prosperity and health for all San Mateo county's communities. We have a list of these countywide projects, and we group them in categories like clean energy, buildings and transit, healthy foods, farms and open spaces, and circular economies and circular reuse of water. And Thrive has visibility to the cross-sector organizations that can collaborate to execute these countywide green jobs projects, but only if we have funding, and where funding's available, as we currently don't have monetary sources for these investments. So an example of what we can do is, one example is Thrive's recently launched impact group that focuses on reduction of single-use plastics. Importantly, the high school community and a broad range of youth are highly involved in this impact group, which is really exciting because they are ready to passionately drive change. And this project is currently identifying fundable green jobs projects to significantly lower plastic waste. These projects would find and train local workforces that could gain job skills that would be relevant for decades. An example of a new project from this group would help lift up our local restaurants and reinvigorate their success. So in summary, the sustainability community is offering to be a partner to the county to address the concerns we all have around the environment. And we want to be a partner in the recovery implementation. We have vision, we have leadership, and we have shovel-ready green jobs projects that address climate mitigation and resiliency and equity. But we need inclusion and we need funding for these high return on investment green jobs projects that we believe have enormous opportunity to improve the community health and prosperity. So thank you very much for your time.
Thank you, Doug. And thank you to all of our speakers today. Thank you to the county for this presentation. I will say that we are out of time. I regret to say that. I know people have places to go, on at least virtually places to go. I also know that we already spoke to the county about a follow-up session focusing on implementation, and that we will get these questions answered that were asked by chat. I wanted to just pause here and take a minute to see if anyone had any burning questions that they really want to ask live. It was really, we had intended to have an open forum. Is there anyone that would like to ask their question live before we all sign off? This is your opportunity. Okay, maybe everyone wants to go have lunch, so that is fine. Please go ahead and leave any comments in the chat, and we're so grateful for your time. And also, I just want to say that the nonprofit leaders did such an incredible job preparing, reviewing the plan, and providing really insightful commentary. We really packed a lot into this hour and a half, so thank you all, and we'll see you online again soon. Have a great day.
Thank you, everyone.
Okay, I guess put my question in the chat.
Yeah, I guess I'll do the same. I thought I tried. Oh, well.
Yeah, I tried to get.
Oh, sorry, I didn't see it. I was looking.
Okay.
I was just wondering if the county had any plans at all to lift the reusable bag ban in grocery stores anytime soon. Because Erin from the farmers market, we've had like it's such a, there's no science to support surface transmission that way, and it's just like drowning in a sea of plastic out here on the ocean. And I just am hopeful that the county might consider lifting that soon.
Peggy, do you have a chance to answer that?
So in terms of the reusable bag ban, this is Peggy Jensen. I had thought that the board had taken action around that, but I will confirm that with our environmental health department, and Georgia will get back to you so you can share that information.
Great, thank you.
And we also have a specific question about the Silicon Valley Recovery Roundtable. That's not the same as the Santa Clara County Recovery. Are you familiar with that? That's what the question was about.
Yes, yes, and we have actually been in conversation with the Silicon Valley Community Foundation, who is one of the sponsors of that group, of that initiative, and we are meeting, I think, later this week, possibly today, with the folks down there. Our initiative is separate, but we have communication.
Catherine, Crystal Foster, you're on the line. Do you have any clarification on that?
The only thing that I wanted to know is my understanding was that Silicon Valley effort was encompassing both of the counties, and it's a lot more business focused than this particular effort is. There's a lot more corporate voices that are at those tables, and there's a lot of very specific recommendations. So I was just curious how it all fit together. Obviously, there's plenty of work to go around, and there's lots of input and lots of county specific work that's important, but I just wanted to make sure that I understood on the implementation side how those were going to work together.
We look forward to our conversation this week and to learning more about what they're doing. At this point, there isn't any connectivity between implementation, but that doesn't mean there couldn't be something going forward.
Hi, Peggy. This is Larry Moody down in East Palo Alto. Hello.
Go ahead, Larry.
Oh, okay. I was waiting for you to say, hi, Larry, how you doing? Anyway, has there been given any thought from the county as relates to convening a discussion with our faith leaders, the actual pastors and those who are governing the local churches, to create an environment where the county can get some feedback from the clergy? Because my understanding right now, it's much of the impact of COVID certainly has impacted attendance and giving at the local churches, but yet most churches down here in East Palo Alto are down 25 to 30% in giving, but yet they are the first place of response for a lot of our local community members as it relates to needs, resources, directions, and those types of things. And I was just wondering if there was any thoughts about convening a discussion. I think there's opportunity to learn a lot about what's going on the streets, in the communities, if we do so.
Larry, thank you very much for the question. We have shared this a very similar presentation with a group of over 40 faith leaders. I think it was last week.
Oh, really?
Yeah. It was convened by the Reverend Penny Nixon, was attended by people from Faith in Action, and others participated in that. However, we know that may not have represented all communities, all clergy. And if there are any clergy groups that you would like us to speak to, we'd be happy to follow up.
Is there a chance I can get a copy of the attendance list so I can check off who was there and who should have been?
I'll check on that.
Okay, thanks. And this was amazing. Thanks for organizing this. It was very important.
Any last questions from the hangers honors? Okay. Peggy, thank you so much for staying on a couple extra minutes and answering those questions. We really appreciate that.
Absolutely.
And I think
yes, thank you to the county.
Thank you, guys. Thank you, everyone. And we'll talk soon.